record button. So now don't say anything bad about me because it's being recorded, okay?
Okay. Good guy.
Let's go ahead and get going. If you guys wouldn't mind muting until you have a question or something, because sometimes we get a little feedback. So. Okay.
Yep, I just muted mine because I have chorus coming in and out. You can hear it, so I muted my background.
Okay, very good. Thank you so much. Okay, let's get rolling here. So, for those of you who haven't heard, a quick background on the horse. A lot of the departments that we work with are going through FAB accreditation. Back in the day, domain 9 is performance management, which is where we play. But people would kind of go through the domains, one at a time. They get down to 9 and say, this is planning and performance management. And I needed this before I got to all the other ones in here. So we called that putting the cart before the horse. So we have a actually family member who is a professional artist and does the horse. So we had the cart before the horse was the original picture back, 15 years ago maybe. And then the horse has just kind of grown all the way through. So the latest one, instead of workforce development, is workhorse development. So there we go. That's the story behind it. Now, we used to do most of the training in one training session here. And it was pretty much perceived actually by one of your departments in Florida as a drink from a fire hose. So what we've done today is taken that down to a drink from a garden hose. And what we're going to be doing is follow-on trainings that will drill down deeper and deeper and deeper as we get through there. So today's going to be a little less. There's still a lot of information coming at you. Again, the first half of it is just an overview. So kind of sit back and take it in. You don't really need any notes or anything yet. The second half, we're going to dig down into log in and that sort of thing. Now, you may have seen that we sent you an updated email or notification today for the meeting, and it had a couple of attachments. One of them is a set of the slides with places for notes in it if you wanted to follow on there. And the second one is the login steps that we're going to go through online here, but kind of leave you with that. So if you get out of there and say, oh, how do I change my password? It's all in that document. So post-COVID especially, we've seen a lot of health departments. We had a health department on the other day, had 10 people on the training, 9 of them were new. So there's a lot of turnover going on in public health, unfortunately. But what we see is a lot of chaos because you got a lot of people coming outside of public health, coming into public health and not understanding all the different stuff that public health has to do. So it's a little bit chaotic. One of the things that the dashboard can do, by the way, is organize any portion of the public health department, and including things like the integrated plan and such. And what we hope for is once you've implemented the system, been trained on it, start actually using it, it looks a whole lot more like this. The things, the chaos has kind of gone away. You've got things organized and ready to go. So again, the horse. Now, where did the VMSG dashboard come from? We're in lovely Phoenix, Arizona. We worked with a couple of very, very large health departments here in Arizona. Maricopa County is the third largest public health jurisdiction in the nation, I believe. It depends on the time of year. So this time of year, when the weather's perfect, we have about 7 million people here. During the summertime, when the weather's not quite so perfect and it's 122 degrees, I think it's just me who's here. Everybody else leaves the state here. But working with these large health departments, we decided to develop the system for them, specifically for the needs of public health. And we only work with public health. So you'll see a lot of stuff in here that is definitely public health related. What the system is basically operational planning and execution. So operational planning is a very detailed planning model to get you down to specific activities that are going to be executed by a specific team of people in a specific time frame. One of the things they wanted to have in here was the ability to keep plans up to date. So think about this. You got a strategic plan, let's say, and you get everybody together to develop the strategic plan. You put a lot of time and effort and money into doing this. Maybe you got an external consultant guiding the process here. And when you get done, you got this beautiful strategic plan. Everybody says, boy, that's the greatest strategic plan ever. It goes up on a shelf and it collects dust for 5 years. The problem is there's not a tool in place to keep it up to date. So that's where the Deming or PDCA cycle comes in. Plan, do, check, and adjust. And by using that and using what we call the real-time planning to keep all that stuff up to date, you can have a perpetual plan, basically. So you're going to update it pretty much every month, so the plan is always moving forward with a 5-year life cycle. So that's why the PDCA cycle. We're going to go into a lot more detail on this. Now, in the FAB world, many of our health departments use the performance management system for FAB. Back in 2011, when FAB issued the first accreditations, our health departments here were some of the first ones. And the performance management system got what they call fully demonstrated by FAB, which is the highest level of compliance for performance management. And one of the reasons is because we built into the system, based on FAB requirements, built into the system the ability to engage everybody in the organization, and including external partners. So if you've got external partners you're working with, you can engage them directly through this real-time planning. And it shows you that FAB 9.1.6 talks about engaging everybody in the department here. Now, one of the things we had to do is define specifically what performance management was in public health. If you Google performance management, you're going to see, hundreds and hundreds of definitions, most of them related around HR, which is kind of not where we are. So we got three phases here. Phase one is developing those operational plans. Now, these are the most common plans that people use, and this is what FAB calls their six-pack of plans, the minimum plans required for accreditation. So a lot of people start out getting these kind of plans. You guys have your integrated plan, EHE plans and such that are already in the system here. So this is the plan and the planning model. Now you got the plans in place, you're going to execute the plans, and then you need to monitor the plans. And you need to monitor those plans in real time so you always have the current information. Now, we like to monitor the plans at multiple different levels, and here's why. The macro level is kind of the big picture. So I can look at an entire plan. So my integrated plan can be on one screen. I can look at my entire department on one screen. I can look at any piece of any plan on one screen here. That's the macro level. The problem with that is if you're looking at an entire integrated plan or a department on a macro level, you may not see the little things that are going on in the background. And that's where the micro level comes in. The micro level is at the bottom of the pyramid here where we have objectives and activities. That's where the kind of the rubber meets the road down there. Those things can start going bad or slowing down or whatever and affect the macro level, but you don't really notice it. So we're going to monitor at multiple different levels. VMSG Public is the ability to take any of that information from any plan or all plans and create a public-facing web page. And literally, we go through this in the performance monitoring training, but it's a very, very simple process. Once you do it one time, it takes you 5 minutes to create a complete public-facing web pages with nice pictures and graphs and charts and that sort of thing. And again, we'll get into the detail on that in the performance monitoring training. Once you've got your plan in place, you're monitoring the performance of the plan, now you can take it through that PDCA cycle. So you got the plan in place. Do phase, you're executing the plan. The check phase is you're using the performance monitoring tools to understand how you're doing against the plan. And then if necessary, you're going to make some adjustments to the plan. And again, we're going to go into great detail with a real live example in a minute here. Now, the planning model, this has been around. I've been in public health about 21 years now, and this has been around since long before I was. It's a very structured operational planning model. It starts out at the top with your organization. In this case, the organization is Florida HIV. It could be a health department. It could be lots of different things in there. Underneath the organization, we have what we call groups. Groups is basically the structure of the department or the structure of the department plus what we call the primary plan. So what you see up here in the bubbles plus your integrated plan, your EHE plans are individual groups. Groups and subgroups can go down to 10 levels deep. Nobody's ever gotten past 5 or 6 to the best of my knowledge, but you got a lot of room to grow in there. So under each group, then you have a set of services or initiatives. Services are ongoing things that you've been doing, continue to do. Initiatives are those new programs you want to implement. Each service or initiative then has a set of goals, each goal a set of SMART objectives, and each SMART objective a set of activities or the steps we're going to go through to get to the objective. Now, we have a little demo organization called USA Public Health. So what I'm going to do now is take you through those 3 phases we talked about. We're going to develop a quick little operational plan. We use the example of tobacco cessation. We're going to take that through its life cycle so we can see all the various tools to monitor it. And then we're going to take it through the PDCA cycle to see how we might do quality improvement on the plan. So I'm going to take you live into the system now. When you log in, you're going to see a screen similar to this, and depending on the user permissions as to how many of these bullets you see over here. But these tabs across the top, if you took that pyramid I just showed you, flipped it on its left side, here's what you have. Organization, groups, service initiatives, goals, objectives, and activities. I'm going to go to my groups tab. And down here, you'll see I'm at community health. So when you log in, you're taken to your default group. So for purpose of today, I'm going to be the community health director. So when I logged in, it took me right to community health. So I don't have to do anything else. I can go to any of my plans or do lots of different things within community health. I can also, though, go select if I want to look at the entire department. How's the department performing today? You notice the levels over here on the left. These are the levels that go from 1 to 10. And like a level 2 always reports to a level 1, level 3s report to level 2, etc. Again, down to 10 levels. For today, I'm going to go down to community health. And then under community health, I have tobacco. So I'm going to select the tobacco 2024 group. I'm going to go down to my next tab, which is services or initiatives. In this case, we have 3 initiatives or future programs that we're trying to implement: tobacco cessation, secondhand smoke, tobacco initiation prevention. So under tobacco cessation, then, I'm going to have a set of high-level goals. Some people call them pie-in-the-sky goals, but they're a high-level definition of what we're trying to accomplish without the detail. So here's some examples. Reduce smoking in high schools. Reduce smoking in colleges. Reduce smoking in public areas. The one common thing about a goal is typically it has an action verb followed by a few words because it's fairly simplistic. Now, if I look at reduce smoking in high schools, you got a good understanding of what we're trying to accomplish. What you don't know is which high schools, and you don't know when, and you don't know by how much, but it still understand that that's what we're trying to do. Now, at this point in time, we set the traffic light out here, and the traffic light is a visual indication of status. And it's exactly as you'd expect. Green is go. Everything's moving along as expected. Yellow is slow down. Something is getting in the way to slow us down. Red is something bad happened, brought us to a dead screeching halt. But then there's a gold bar in there. Gold bar indicates successful completion of that portion of the plan in there. So those are the traffic lights. And at the goal, objective, and activity level, you'll see the traffic lights in there. Now, to get to reduce smoking in high schools, we're going to get down to what we call those SMART objectives. Our nomenclature is specific, measurable, attainable, realistic, and time-based. Focus primarily on specific, measurable, and time-based. So here's an example. Reduce smoking at Wayne High School, so that's very specific, by 25%, so that's measurable, by the end of the school year. That's our time-based. So this is a SMART objective here. Now, in order to get us to that objective, we're going to assign this person called an objective lead. Steve Hansen's our objective lead. To do that, I click on the down arrow and say show all users, and it shows me all the staff in my little tiny department here. I picked Steve Hansen to be our objective lead. Doing that, Steve gets 2 jobs basically. Oops. Number 1 job for Steve is as a project manager, program manager, to get us to this 25% reduction. Number 2 is to update the status. In this case, how far along are we in our 25% reduction? So Steve is the program manager. The way Steve is going to typically do this update is through what we call real-time planning. So Steve is going to get an automated email notification from the system on a regular basis, typically monthly. In that notification is a link that takes him right back to this objective. He can go in and update this. He can update the traffic light. He can put in a note and be done with it. So just a very efficient way to keep the information up to date. A couple other things you'll see down here, this notes and comments field. Notes and comments are a communication vehicle. You're not going to be the only one looking at this particular objective. So I want everybody else to know the status by doing that. So if I were to turn this light to yellow, I might put a note in here that says, hey, Steve is going to be retiring at the end of the month. We don't have anybody to replace him yet. So I marked it as yellow. Or I could mark it as red and say, Steve just decided to leave the organization. We don't have a replacement for him. Mark it as red. Or if I were to get to really a 25% reduction, I could mark this as gold, but typically it's an ongoing thing, so it's going to continue to be green. This little button right here puts a time and date stamp, so you notice the date, the time, and Fred Erickson as the person who put the note in there. You don't have to use that if you don't want to. There's some notes that don't make sense to do that. Sometimes you're just, wanting to put that in, so if somebody looks at that and says, how did you get to a 25% reduction? They can call Fred and go from there. Down at the bottom, we have the ability to add data sources. In order to get this information, I'm going to have to go to somewhere to say, hey, how far along are we? It could be the Wayne High School website. In this case, we're going to say we're going to keep that information on the CDC Smoking Cessation Fast Facts webpage. Now, I've got that tied in here to where all I have to do is click on this link, and it pops open a new browser window for me. And there we are, CDC Smoking Cessation Fast Facts. The reason this is cool is because you're going to have to be able to get the data from someplace, whether it's on your own network, outside on a website, wherever it is, to be able to update this information. So why not have it at your fingertips? That's what that does for you. So that's my objective. Now, to get to that objective, we're going to go through a set of steps. We call them activities. Some people call them action steps. There are three distinct types of activities in the system. Project-based is by far the most common. QM, or quantitative measurement, is next, and then quality assurance is third. I've got an example of each of these I'll walk you through and just give you a little bit of detail. Again, the next training, we go into excruciating detail on this stuff. So our first one is a project-based activity. So think of anything that's a project that's going to be, completed in a given time frame. It's going to be a project. Create training content materials for students and faculty on the dangers of smoking. Every activity's got a performance metric. How do I know when I've successfully completed the activity? The training content materials have been created. It's pretty simple. I've got a beginning and ending date in here. These dates can be adjusted over time. So I know a lot of people were using the system before COVID, basically came to a screeching halt during COVID, are now getting back into it, and the dates are pretty much all out of whack. So we're doing the updates on those dates. Now, if you have a bunch of these that are supposed to be ending on the same date, let me know. I can push all that down for you automatically, so you don't have to manually do it. This particular activity is measured by percent complete. So you notice down here, we completed chapter 1, and there's 4 chapters. It was probably at 25 at that point. Chapter 2 is 50, 75, and 100%. So that's just our measurement on how far along we are. In order to get us to these activities completed, we're going to assign a team of people. So I'm going to go and click on the little black X, which just takes off all my filters up here. And I'm saying we have team members. So we got 3 team members, as you see. We have a team lead. Diane's our team lead. And Diane is going to get the email, that same one we talked about with Steve, to come back in and update the status of this particular activity. Over here on the right, FTE, not used very often, but if you're doing grants or you're doing budgeting, you can put in here how much of this person's time is dedicated to this activity during the timeline of the activity. And then what that shows you is how much is it costing us to do this particular activity. And what I can do with that very simply is I can roll it up the pyramid. So at the activity level, you see the addition of this gives you a 0.5 FTE. If I take these 3 activities to their objective, it's a 1.0 FTE, and I can go all the way up the pyramid. So that, again, the idea is costing it out to be able to understand how much grant money do I need, or in the next year's budget, how much do I have to put in for it? So that's our internal to folks here. We also have the ability to attach external partners. So you can see we have VMSG Dashboard as an external partner organization, and within that organization, we have Fred Erickson as the contact. You can have as many contacts per partner as you want and as many partners as you want, and you can attach as many partners and as many contacts as you want to that activity. In this case, we're just saying it's Fred at VMSG Dashboard. Now, there's also an option to make Fred a system user, which then allows you to assign Fred as the email recipient. So now he can get that email, link back in, and update the activity. And it's a chat with your partners here just to make sure that they're okay with doing that. And if they are, we'll train them on how to do it. It's a simple process here. So that's my first activity, is create the training content. My second activity, I'm going to provide 9 training sessions each month on the dangers of smoking to students and faculty. So I'm going to take the training content, go to the schools, and provide the training sessions. This activity, the QA activity, is unique in 2 things. Number one, it's repetitive. So we set a frequency anywhere between weekly and every 5 years. In this case, we got it set to monthly. And we can set the values that will automatically change the traffic light for us here. So the green value is 9, our 9 training sessions. We get to 9 or greater, we're green. If we only get to 6, we decided that's not good enough, that's red. And if we get to 7 or 8, it's going to be yellow. So you notice down here, we're sitting at 8 training sessions done, and hence the light is yellow automatically over here. So that's our second activity. Our third activity then, in parallel with doing training, we're going to go contact those dastardly tobacco vendors to make sure they're not doing anything bad out there. So I'm going to contact all 20 tobacco vendors within 1 mile of Wayne High School to ensure they're not selling to minors. This is a QM, or quantitative measurement activity. The only real difference between it and a project-based activity is we have a target quantity. By having a target quantity, we can do the math. So in this case, we're saying if we have 20 out of our target of 20, we're at 100%. If we had 10 out of 20, we're at 50%. So pretty simple. So those are the 3 activities we believe are going to get us to that reduction of 25% at Wayne High School. Now, if we go back to the pyramid, it looks like this. The group was Tobacco 2024. The initiative was tobacco cessation. Our first goal was to reduce smoking in high schools. We've chosen Wayne High School to reduce by 25% by the end of the school year, and then the steps we're going to go through to get there. So every plan fits into this planning model. And the nice thing about that is you have multiple plans as you would in a large health department. They all kind of look the same. So as you're comparing plans, looking at status, it's much easier to see it that way. So now we have our plan in place. Let's take that plan and walk it through the PDCA cycle. So we got the plan in place. Obviously, we're going to now execute the plan. So what we're going to do in this particular case is Diane is going to lead the team to create the training content. William is going to take that training content, go out to the schools and do the training 9 sessions a month. And then Tom is going to go out and talk to those tobacco vendors to make sure they're not doing any bad things. And again, this is where the real-time planning comes in. The email notifications are going to go to those people who are actually doing the activities. Now, what we don't recommend is that you send those emails to their supervisors or somebody up the chain, because you're wasting a lot of time. The supervisor then has to go find Diane, ask Diane, how far along are you in creating the training content, interpret what she says, go back, find the activity, and put it in there. If you go straight to Diane, she knows how far along she is, and she can answer that email immediately because it only takes seconds to do. So ideally, going to the horse's mouth to get the information. So I'm collecting all that information in there in real time. And the reason I'm doing that is for the check phase. The check phase is comparing the plan to the actual. Well, collecting that information in the background is giving me the actual. So in this particular case, I'm going to do my check, and it's going to look kind of like this in this particular case. So I'm going back to my objective, and I want to say, hey, how far along are we? This little chart button right here shows me that. There we go. We started the program with a 0% reduction, slowly ramped up and got up to our 25% target. So this says our plan is 25, our actual is 25, everything is beautiful here. This is what we call micro level performance monitoring. This is down at the objective level. Now, that was our check phase. If you're collecting that information in the background, it's that easy. If you're not, you got to go collect the information first and then come back to it. Big waste of time. Let the system do the work for you. The adjust phase. If necessary, you can make some adjustments here. In this particular case, we saw we were right on track, so we're not going to adjust the plan. We're going to continue to execute. We're going to check it every once in a while, continue through the cycle. Let's assume for a second that we only got to a 21% reduction, not the 25 that we had planned. Now we got to make some choices. First of all, did we get a little too aggressive on the plan? Is 25 just too much? If so, we can adjust the plan down to say 21, continue through the execution, check it, and continue through the cycle. The other thing we might say is, no, I think we can still get to 25. Let's adjust the resources. So in this case, we maybe go from 9 to 12 training sessions a month. Maybe we found out there's a whole lot more tobacco vendors out there, so we need to go get hold of those folks. Maybe there's some activities we hadn't even thought of yet to get going out there. So in the adjust phase, we're going to be able to adjust the resources as well. The fourth option is kind of an in between. Maybe the plan is just a skosh too high. Maybe 23 is a good number in here. Maybe if we take and adjust our resources, maybe go to 9 or go from 9 to 12 training sessions a month, we can get to 23. So those are the options in here. But the cool thing about this is this keeps your plans up to date all the time so that you're always working with real-time data. Pardon me. Now, we talked about micro-level performance monitoring. Macro-level performance monitoring, kind of the dashboard is kind of the namesake here. Let's go back and look at that. So I'm going to get out of here. I'm going to go back to my groups tab up here. So the dashboard screen is based on the group you have selected. So if I want to see the whole department, I can see the whole department on one screen. If I want to see just my strategic plan, I can see that on one screen. Again, for today, I'm going to be the community health director. Again, when I log in, it takes me right to community health. I don't have to do anything else except click on this little traffic light up here in the top right corner. And what that's going to do is go into the background and gather up all the data points from everything within community health and present it to me on one screen as kind of the real-time performance of community health. And here it is. Now, one thing that's been asked a couple of times, if you're a senior leader and you don't really go into the plans, you don't want to do reports, all you want to know is, how am I performing in my area of responsibility? This homepage button up here does that for you. It says, when I log in, take me to this dashboard screen as my home page versus either the main menu or the reports menu. So you can do that. So, it's all I want to see is performance here. The first thing I look at is this top left corner. I call it the big picture here. And what that is either the number of activities or objectives or goals with these traffic lights. The traffic lights have a little mouse over on them, which means I can click on this and drill right down to those 5 activities or this one activity. It's also showing me where we are in the timeline. So we're 19 days ahead of schedule, so it's green. When we get down to below schedule, it's going to be yellow. Get 60 days below schedule, it turns red. So by looking at the lights and the numbers up here, you get a good snapshot of performance. In an ideal world, you're green here. You got a lot of gold and a lot of green and very few yellows and reds in there. Now, to drill down from there, we got a couple of different views at the bottom. Number one is my people. So those folks that I assigned as activity leads show up down here. This column is showing me when did they last update their information. You notice it's color coded. Green is less than 30 days ago, so there's kind of your ideal point. Yellow is 30 to 60. Sometimes it's okay. Somebody's on vacation at the end of the month or whatever. Red, I'm going to talk to Mara and say, hey, Mara, can I get you some training on how to update the information in the VMSG dashboard so you can get kind of caught up with everybody else? Now, there's an old adage that says people listen to what you say, people do what you audit. So think of this as kind of a mini audit. So I'm the community health director. I'm having my monthly meeting with my staff. Throw this up on the big screen in my office here and show everybody what that column means, what the colors mean on there. I will guarantee you that the next month when you go into that meeting, everyone will be green. People do what you audit. There's a mini audit. Here's a roll up of the FTE by person. So how loaded is each person based on the assignment you made? The lagging column says I have activities that are calculated to be behind schedule. My days column says how far ahead of or behind schedule am I for all of my activities. Diane's way ahead of schedule. She's 100 days ahead of schedule. Andrea's about 6 days behind schedule down here. So it gives you a kind of a snapshot of how far along am I in my performing my activities based on my timeline. Overdue says I have activities that are past the ending date and not yet 100% complete. And then a number of red, yellow, green, and gold. So this is a snapshot of the performance of each person if you're assigning them at the activity level. I have 2 other views here. The groups view just shows the groups down here and the exact same information over here for the groups. And priorities is the strategic priorities from typically your strategic plan, but in your case, it might be from the integrated plan compared against everything else in the system. So it basically says, how are we doing against our strategic plan, our strategic priorities? Top right corner, my priorities, individually selectable objectives that you personally want to keep your eye on. If I roll over here, you'll see all the pyramid for the objective in here. Most often they're yellows and reds. Most often they're things that you're personally working on or you've assigned to your team members and they're working on, and you just want to keep them front and center. It's a bookmark, basically. So that is the macro level dashboard screen. Again, you can look at anything, any group, any subgroup on this, and you can include groups and subgroups on it. Now, not everybody in public health sits in front of a computer all day long. So we decided we would add some features to your phone to allow you to get some of the same features like your dashboard. This is the same dashboard you just saw broken down into your phone. Now, kind of the cool thing about it is we've been working in public health a long time. A lot of public health departments have IT restrictions on what you can put on your phone. This doesn't use an app. It's actually what we call a dynamic app, meaning that it builds the app dynamically in the web browser on your phone. So you go to the same exact link that you do to log in on your desktop, same exact login credentials. It knows it's a phone. It takes you to VMSG Mobile, and there you go. And it's always up to date, and it's always real time. So this is the top left corner, the bottom, top right corner. Everything's clickable on here. I can drill down to anything on there. It's all the same function, just again on your phone on 3 screens versus 1. Now, what we just went over is what we call the core functionality of VMSG. So all of the planning, all of the performance monitoring, all of the PDCA stuff is in there. Over the years, we've added lots of additional features at the request of a lot of the health departments in here. But for today, because we're going to be drilling down on those in future trainings, I'm just going to kind of review a little bit here. Then I want to take you into detail on a couple of things. The real-time planning, how that works and how you're going to respond to it. The quick update screen, so how do I update the information I've been assigned? And then we're going to walk through the login process. How do I get my login credentials? How do I log in? And then we're going to talk about help and training information built in there. So first of all, intelligent document management. You can attach documents anywhere, any place in the system. You can attach them to people, attach them to plan elements. Originally developed for FAB accreditation, where you got to submit hundreds and hundreds of documents to FAB. Just a good place to keep all the documents. You get a lot more information about them. They're always backed up on a nightly basis. You always know where they are. So it's kind of a cool tool. You can also use it in addition to specific activities. We call it timeline activity to manage the timelines of policies. So most policies have to be updated, every fiscal year or something along that line. So we can set up an activity that says, update this policy by the end of this year. And Fred is assigned to it, and it's going to notify Fred when it's time to start the update process. He does the update, uploads the new document, version control's automatic, and he's all done for the year. So it kind of puts all that together for you. Lots and lots of reports in the performance monitoring training. We go into the detail there. VMSG Public, again, create that public-facing web page for anything in the system. 3D planning is the ability to kind of cross-reference everything in the system against each other. So I can look up and say, again, how are we doing on our strategic priority number 1 on our strategic plan or whatever. The real-time planning, I'm going to go into more detail in a second. And then for those departments that are going through a FAB accreditation, we have all of the FAB plans built into the system. It's basically automates the process of going through accreditation, which is a very extensive process, as you well know. So real-time planning. Again, this is critical to keep the information up to date. And it's once you do it one time, you find out how easy it is. And it only takes you a couple of minutes a month to do it. Everybody's willing to participate in that. And then you'll know you have that real-time information, again, on the dashboard screen. So here's how it works. Let's say we set it for the first Monday of the month. First Monday of the month at 1 a.m., the system goes in and looks at everybody you assigned as an objective lead or an activity lead. And it asks 3 questions. Number 1, has this person been in and updated their information in the last 30 days? Number 2, does this person have anything that has fallen behind schedule? And number 3, does this person have anything that's overdue? Today is past the ending date on the activity, not 100% complete. If none of those are true, no spam. If any of them are true, out go the emails. Again, the emails can go to external folks as well as internal folks. In that email is a link that takes you back in with the option, because you're an activity or an objective lead, to go to Quick Update. Quick Update is just 2 screens, activities and objectives, simple way to update it. When you're done with that, you log out. Typical process for this across 240 some odd health departments is about 3 to 5 minutes per person per month. So think about that. If you divide this up amongst the folks in your staff and have everybody update their own personal objectives and activities, you're going to have real-time information because it's so efficient to do. Now, the activities quick update screen looks like this. The top of it is merely the context from the pyramid. The bottom of it is, this is the activity I'm updating, number 1 of 29. But I only have to update 3 things typically. Traffic light, data value, notes field. I've got a time and date stamp for the note if I want it. I've got my data source down here if I want to look at it. Hit the next button. Cycle through my activities. Very similar screen for objectives. Cycle through that, log out. 5 minutes later, you're done. So now what I'm going to do next is, well, first of all, document management. I'm going to show you how documents are managed when we get into the quick update here. It's a very simple process, and you can attach any document you want anywhere. But the reminder email that goes out looks like this. So those 3 criteria I mentioned as to why did I get this? This is just an FYI. For all the activities you've been assigned, here's the current traffic light status. Your system administrators will appear here, so you know who they are, the email address, and the phone number, so you can always kind of contact them if you have any questions or any problems. And then the link. This is the login link to take you right back into the login. Now, first thing I'm going to do is just kind of walk you through the steps, and then I'm going to actually go in live and do the whole login process for you. And again, I attached a document to the meeting invitation that walks you through these steps as well, so you have that after the fact. So first of all, the link, login.vmsgdashboard.com. If you just want to go to vmsgdashboard.com, in the top right corner, there's a link that takes you to here. There's going to be a dialog that comes up. It's got 3 buttons. The leftmost button is called Send, meaning send me my login credentials. You're going to hit that. You're going to enter your email address, hit send again. Hopefully you'll receive the success dialog, meaning you're in the system. If you get anything else, some kind of error, can't find your email, whatever, you're probably not in the system yet. Send me an email. I will send you back the information that I need to collect from you, and we'll get you in the system. It's pretty simple. If you don't get the success, again, contact me. I'll get you set up. There's a login button on the middle of the screen. I'll show you here in a minute. Click on that. Takes you to the same dialog you started with. This time you're going to enter your user ID or email address. You don't have to remember a new user ID. If you just want to use your email as your user ID, you're welcome to. You can go back and forth between them. It's going to stay the same. Enter your password and hit login. So that's the steps that you're going to go through. Now, that email that you get is going to look like this: user ID and password. For the first time you do it, I highly recommend that you copy and paste that password out of the email to put it in the system. The reason being that there could be a bunch of cryptic characters in there, and sometimes tough to read, where is that on my keyboard kind of a thing. So copy and paste will eliminate that problem. Let's go in and actually go through it now. So these are the quick buttons, we call them, up here at the top right corner. You got the traffic or the dashboard at the traffic light here. This is your reports menu, the blue one. This is your main menu. This is help and information, and this is log out. I'm going to go to my log out button, and sure enough, I want to log out. And then this is what I was talking about, the VMSG dashboard homepage up here at the top right, already a user, click here. We'll do that. It's going to pop open my login dialog. And here's my send button. So I'm going to say, let's go ahead and send me my credentials. And I'll hit send again. Now, hopefully I get the success dialog. Yep. Meaning I found your stuff. I sent it to you. The email goes out immediately. So if you don't get it within a minute or two, check your spam folder. Here's the login button I was talking about. I'm going to click on that. It'll take me back to that same exact dialog. I'm going to put in either my username or my email up here. I'm going to put in my password down here. Again, for the first time, please copy and paste it out of the email. It'll save you a lot of trouble here. Then I'm going to hit the login button. Now, because I've been assigned as an objective or an activity lead, I'm going to get this dialog. Main menu is where we've been all day. We're going to go to quick update this time. So the first thing it's going to do is take me to the activities quick update screen, which is going to have just the activities that I personally have been assigned. And here it is. First thing you're going to probably want to do is change your password. That's this little key button up here. Now, if you're on the main menu, I think it's the 5th menu item down, something like that, is a key button just like this, and you can change it from the main menu. Click on that. Again, copy and paste out of the email your current password, whatever new password you want, verify your new password, hit update, and away you go. So that is the password. So I'm on activity 1 of 9 right here. Things I'm typically going to change is I'm going to cycle through my traffic lights. I'm going to put in a data value. So that would be how many training sessions did I do, how many tobacco vendors did I contact, etc. This button right here puts this date and timestamp in front of my note and puts the note at the very top of the list here. So in this case, I say Fred Erickson, change to yellow because Fred is retiring next year, don't have a replacement. Okay, so that's the kind of notes that you're going to keep in there. And then I'm going to hit the next button. I'm going to go ahead and just cycle through all of my activities here. We'll get to the objectives here. So I'm on activity 9 of 9, as you can see up here. If I make any changes, that's fine. Sometimes you don't make any changes. Just hit the next button. Nothing has changed. Hit the next button. So I'm also an objective lead. I'm going to go ahead and say, let's update my objectives. So very similar screen. Still, again, only 3 fields to update. Traffic light, data value, notes field. I got a data source here if there's one attached. I'm going to hit the next button. I've only got one, so it's going to log me out if I do that. We talked about document management. So you notice up here, this is the document management. And by the way, this is on every screen. You can attach documents anywhere in the system. I'm going to click on that. You notice it says 3 documents. I'm going to click on that. And whoops, there's only 2 documents. Well, the reason is because of version control. Show all versions. By default, it shows just the latest version. If I say show all versions, there we go. So we have test document version 1 and 2, as you can see over here. Now, documents are real easy. To add a document, you just hit the plus button down here. It's going to give you a little dialog that says choose your document. So you're going to pick it off your network drive, your hard drive, whatever you're going to do. And then you're going to say upload. There's another button that says upload. It'll put this file name, whatever you selected, down here, tell you the size of the file. put in today's date as your ending date. Now, this is kind of a nice field to have. We talked about every document has a life cycle on it. If you put in the ending date of the document in here, every time you look at it, you're going to know that, hey, we're in good shape, or it's getting on towards time to update the strategic plan or whatever it is. You can put in any kind of note you want here. It'll scroll forever. Or I'm sorry, a description down here is the notes. So whatever note you want to put in, same thing, it'll scroll forever. I can use the traffic light. What we see a lot of people, and typically in the accreditation or something along that line, the documents, yellow is a draft, green is we as the department have completed it, gold is it's been submitted to wherever it's going, in this case, maybe EFAB. And then you just go ahead and save it. You're all set to go. To download the document, you can just click on it here, or you can click on it up here, or you can click on it here. So you can just download the document to your hard drive, do your updates, upload the new document. So that's document management again on every screen. So that is the objective quick update and document management. Now, again, not everybody sits in front of a computer all day. So if you need to do your quick update, you're driving in the office in the morning, you're driving by Starbucks. If you're like me, your car pulls hard into Starbucks and says, hey, I got to go have a coffee in here. I'm going to go in and sit down. I'm going to have my coffee, pop open my phone. It's the first Monday of the month. Here's that email from VMSG. Okay, I'll just go ahead and do it right here. Click on the link. Again, same link, same login credentials. You log in, you select quick update. You're going to go through your activities here. When you're done, you're going to go through your objectives. You're going to log out. You're going to be done for the month. So just a nice, efficient way to be able to do that here. Now, the last thing I'm going to show you is all of the built-in help and info functions here. So let's go back to here. I'm going to go to my main menu, which is this guy here. And I'm going to go up to my services tab. So I have a question about how do I add a service? How do I remove a service? What are all these silly buttons for down here? Help and information is under the blue eye. Click on that. It knew where I was, so it took me right to adding and managing services. This is, I call this my left-brained approach. It's just the steps you're going to go through. Add a new service, click the plus button, enter the service, hit the save button. Simple stuff. In addition to that, there is a video training module down here. It's about 5 minutes long, and it kind of walks you through the whole process. Down here is the user guide. If you want to download that and put it on your desktop, it's a hyperlink PDF file, so click on a table of contents to go anywhere. Down here is a implementation guidelines document. So if it's the first time you're using the system, it's worth a read because it's stuff we've collected over the last many, many years from clients about what works really well, what doesn't work so well, what did we do to engage staff to get everybody on board here. Here's some templates we created to develop operational plans. Here's some IT issues we ran into with firewalls and emails and that kind of stuff. So all that stuff is available to you. Up here at the top left corner, we have 5 video-based training modules, total of about 3.5 hours if you go through them all. Today, we're going through the intro, so you can skip that. Next thing is basics, which is kind of the all the buttons and fields and screens and that sort of thing. Next thing we'll go through live is operational plan development. So how do I put a plan in a system? What are some examples at each of the levels of the pyramid? We have a bunch of live public health examples there. What are the examples of there? We're actually going to go through and enter an operational plan so you can see every mouse click and everything that you got to do. And then at the end of this one, we provide a little or ask for a little homework here. The homework is to go out and create a very, very simple operational plan, whether it's something fun, something business related, whatever you choose. We've had planning my Las Vegas vacation, planning my kid's birthday party, planting grass in my backyard, whatever you want to do. Typically 6 planning elements if you're going to put it in there. And then what we'd ask you to do is we'll have a review session where we'll go through and actually look at those plans, whether they're in the system or you put them in a template or scratch them on a napkin, whatever you want to do. We're going to look at them and just kind of critique them and review them a little bit. The next training after that would be performance monitoring training. Performance monitoring is all the charts and graphs, VMSG public, reports, and all that kind of stuff. And then for those folks who are designated as administrators, managing users, managing permissions, there's about a 30-minute training module there. So that is all built in, available 24/7 for those folks who just want to do it on their own time. They don't want to sit through sessions like this. That's fine to do. And that was your drink out of a garden hose / fire hose for the day. Questions? Anything else you'd like to see here before we dig into newer ones on the next training.
Well, thanks, Fred, for this great overview. I mean, I guess a couple of things. First is, I know we just sent you our information about logging in. We're kind of, let's see, obviously new to this, but we're our department was supposed to have access to it, and I'd be curious to see what is in there. And I don't think we're using it for fab. We're using it exclusively for
Yeah.
ending the epidemic.
Yeah.
I know obviously we need to look at our work plan, our grant, whatever we've submitted, and get familiar with that. I mean, I don't know. Do you have access to our
I will
DOH?
I will be putting your information in there, and then you've got the login information in there. Just go in and you can look around. I mean, just gather around and figure out what's in there, and then we'll have to build the plan on how we're going to get from where we are today to where you need to be.
Okay, all right, that's fine. So, yeah, I know you're going to give us access because we didn't have our information that to you, the username and all that.
Yeah.
So we just sent that to you like 2 minutes before this
Yep.
meeting. So
I'll get that put in the next few minutes here, and I'll send you guys an email letting you know it's in there and ready to go. And then just look around.
Okay.
Again, my contact information. If you have any questions, always feel free to reach out to me. Email, phone, text, whatever you want.
Okay, no, definitely appreciate that. I know, yeah, we've got some homework to do. I'll definitely take a look around, and then see what our next steps are. And then I guess, do we need to try to schedule our second meeting, or should we?
Yeah, we want to schedule the second training. Contact Andrea. She's always copying on my emails. She does all the scheduling here.
Okay.
So, typically, the next session is about 45 minutes to an hour as well. Then we do the homework. Then we do a follow-up session, which is pretty short. And then we go into the performance monitoring training. So, yeah, get with her and just kind of set them up, usually a week apart, because we don't want to bury, people. I know you got real jobs to do as well.
Right.
So if you contact Andrea,
Okay.
she'll get it scheduled for you. We'll get you guys moved through the whole session, and you'll see it'll kind of, the lights will go on more and more as we get deeper into the training. This is just an overview. Once you get into the training, you get access. You're going to be able to go in and do a lot of stuff in there.
Yeah, no. This is a pretty impressive program here. I'm definitely looking forward to playing with it and seeing how it works. Like you said, just tying everything together.
Yeah.
Not only with EHE, I could definitely see myself using it for other projects as well. So
yeah, everybody starts out, with the basic stuff, and then said, "Can I do this? Can I do this? Can I do this?" And you end up with, and you can do it for everything you want. It's a great way to track things and plan things. I also I have a recording here, so what I'll do is I will pop this recording up on YouTube and send you a link to it.
Okay. Well, definitely appreciate it, Fred.
Thanks,
Joanne.
everybody.
Did you have any questions?
Yes, I have just one question. First, thank you very much, Fred, for this overview. My question would be, anything that's in the dashboard right now, it's information that we put in, right?
I don't know. I'm assuming you guys did, but I'm not sure. Warren Garrison is kind of leading up the charge, I think, with the FDOH HIV. So you might want to coordinate with him, and before you take anything out or putting anything else in.
Yeah, that's where I was going with it. I was going with it. If we find out that some information probably are inaccurate or we need to update, do we do it, or does it have to be done by Warren? Because I know we're under the state of Florida, so I don't know exactly.
Well, just anybody can do it. You guys will have access to do it, but just coordinate with him so that you don't get more people doing it.
Okay, thank you.
Okay, thank you guys. Have a wonderful week.
All right, thanks, Fred. We'll talk to you soon.
Bye-bye.
Bye-bye.